Hi, I'm Tom Reid. I'm the Chief of Dufferin County Paramedic Service. I've been a paramedic for 30 years in this county. I've been in a leadership role for 20, and it is my pleasure to provide you an overview of the 2016 operating and capital budget. During my presentation, I'll give you an overview of the different areas of our service: general operations, community paramedic, and offload nursing program. The primary responsibility of the paramedic service is to first respond to emergency calls within our community. This is primarily through the 911 service for those sick and injured. A second major focus for our service is providing inter-facility transfers within the province. So most of the time that would mean from our local hospital into the Toronto or GTA, but on occasion it can mean anywhere in the province or even out of the country. So for example, we can transfer patients from locally at Headwaters to Hamilton to London to Windsor, and sometimes even into the United States. Our primary high quality, compassionate, and safe evidence-based care is something that we always strive for. We want to be able to provide our patients and our community with the best care that we possibly can. And how do we do that? We work with education, we do chart reviews, we have a third person reviewing and oversight of the paramedics. We have a strong education program and a strong quality assurance program. We take a look at how paramedics are performing. We identify areas of improvement. We provide education so that we know that the patients, again, in our community are receiving the very best care and under the best practices in the province of Ontario. As you know, we have a lot of rescue type calls. We have motor vehicle accidents, we have industrial accidents, we have farm accidents, we have the sick and injured. And a lot of times these things happen under the worst weather conditions. It's imperative that as an employer, as a paramedic service, that we provide our employees the safest and the highest level of training that we can to ensure that they go home the exact same way they came to us, and they're able to safely come back to work the next day to be able to provide emergency care to the members of our community. I spoke about our quality assurance program. 100% of the documentation and the care that's provided by the paramedics is reviewed to ensure that we are indeed providing the best care possible. A program that we're very proud of is our new public access defibrillator program, where we have provided over 130 public access defibrillators in public buildings within the county. So the next slide is, how have we changed over the years? Well, the demographics of our community is that we're getting older, and when we're getting older, we have more requirements for health care. So we're seeing this as a paramedic services. So in 2005, we did 3,966 life-threatening calls. And you can see that over the number of years to 2015, we've had a constant increase of calls. In the fact that we're projecting in 2015 to have a 13% over 2 years. Some interesting statistics is that over 50% of our calls are folks over 65, and we're expecting this number to even grow higher. So we've have some programs to try and identify and curve this increase, which I'll touch later in my presentation. I'd like to take a moment just to go over some of our recent accomplishments that we're really proud of. One of our most successful programs is our Community Paramedic Program. Now, we were able to work with our community partners, the LHIN, and the local hospital to develop a program where paramedics weren't working under a 911 system. They were working with folks that were at home that were unable to get out, could be shut-ins, and we were able to visit them in their home, be able to do home assessments. We were able to look and be able to assess these patients before they had to call 911. Our hope is by supporting people well in their home that we'll be able to keep them there, and therefore reducing emergency calls, reducing hospital waits in the local hospital, and increasing their experience of living in their own home in a safe environment that is supported. Another program that we're very pleased to have brought in is the offload nursing program. This program is where sometimes when there's a number of ambulances that arrive at the emergency department, we're unable to get our stretcher offloaded. This is a problem for us because it eats up our resources, and then it causes delays in responses to our community. So we again worked with our local partners of the hospital, with our local LIN, and in this case the Ministry of Health primarily, and they have funded the offload nurse program at 100% to the tune of about $130,000 a year. That's made a big difference in the amount of time for our turnaround for our ambulances, and have done a remarkable job of getting them back out in the road and responding to our community. We've also implemented a electronic call report, which is the chart that the paramedic completes after they've taken a patient to the hospital. This has helped with statistical data. It's made it more accurate. It's very timely. It's where all all documentation within the hospital and medical center is going. From a patient care point of view, our next two programs that have been initiated is the STEMI bypass program and the stroke bypass program. These programs are where we've identified a particular medical problem that is sent to a tertiary center or an area of excellence. When I speak of the STEMI program, that's if a patient right here in Dufferin County has a heart attack, and we do a 12 lead, we assess the patient, we diagnose that they're having a heart attack or myocardial infarction, and we take them directly to South Lake, who is a regional cardiac center. The person then receives treatment right as we arrive. A team's called in, the patient's transferred directly onto the catheterization table. They enter a catheterization into the person's heart and clear that blockage in the heart, therefore saving cardiac tissue. This has been one of the most amazing programs. We have seen people that have been very, very sick and acutely ill, and they've been cured right before our very eyes. And I'm sure if you chat around the community, you'll hear lots of stories of people that have had this happen, and they're the most amazing. We work with our own hospital after they've been treated at South Lake at the Cardiac Regional Center, then they're referred back to Headwaters and back to their primary physician. The stroke bypass program that we're using has a number of strokes. So a patient that's in Dufferin County that has a stroke could be referred to Trillium or to Royal Victoria Hospital or to the Grey Bruce Regional Center. Again, it's based on someone having a stroke. It's the importance of them calling 911 right away, and then we go diagnose them, treat them, and transport them to the in a stroke bypass center of excellence. Again, this has been very impactful for the patients that this has affected and our community as a whole. The other significant accomplishment is the installation of 130 public access defibs in our community. I've had the pleasure of being involved in a number of success stories where someone has had a sudden cardiac arrest and they have been saved by a public access defibrillator. In fact, some of the ones that we've placed in our community. there's nothing more than rewarding to say that we've done CPR training, we've provided public access defibrillators, and someone in our communities had the unfortunate having a sudden cardiac arrest, early CPR by either a bystander or by 911 emergency responders, and having paramedics successfully resuscitate, and have that patient sent into hospital to make a full recovery. And we've had numerous stories in that case, and it is something that we are all should be very proud of. Some of the recent goals that we've set for ourselves are goals that we've always had. And one of the goals is to provide the highest level of care. And I've spoke about our quality assurance programs. I've talked about our education. And that's how we decide. It's something that we always have to be committed to the highest level of care and compassionate, caring, something that is working for our community. And it's something that we've never stopped working at. Things that we try and do to ensure that we're providing patient surveys, making sure that it is the right service at the right time to the right patient. Those are some of the ways that we review to make sure we are providing the highest level of care. We identify trends through this audit to make sure, again, that patients are getting the highest level of care, and we make appropriate changes if we're not. So if there's something that we've identified that is education or equipment or just a changing practice, that we stay on the cutting edge of care for our community. But at the same time, we know that dollars are limited and we have to be fiscally responsible. We've done our very best to do that, and I'll review the increases that we're projecting for this year. One of the main things that we have to really look at as a community is what services are already being provided in our community. And we think by working together with our community partners and making sure that patients are able to navigate the system properly, and so that they can maximize the care that is already in place, so that they do get supported in their own home, for example. And I'm going to speak more about our community paramedic program as we go forward in the presentation. The 2016 operating budget, we are projecting a 3.42%, or roughly $100,000 increase. Now, the new programs that we had discussed earlier, the community paramedic program and the offload nurse program, they are 100% funded by the Ministry of Health. It was an application process. We made a business plan. We got our support from our community partners, the hospital, all of our support services within our community care access, Alzheimer's Society, telecheck, community mental health, the local LIN. All of those folks worked with us to develop a program that was presented to the Ministry of Health, and then in turn was actually funded so that we could have a community paramedic 12 hours a day, 7 days a week, keeping people in their own home. The nurse program, again, was 100% funded by the Ministry of Health and has made great strides in clearing up the ambulances. Now, for our operating budget, we have projected that we should be increasing slightly our supervisory role on weekends, and that's been represented in this increase, but primarily the increase for the 100,000 or 3.4 is related to the cost of salaries and benefits for the paramedics of our service. On the capital side of our budget, we're projecting a 10.6% increase, or roughly 25,000. In 2016, we're planning on replacing one ambulance. We are going to be replacing the onboard computers. That's a requirement to upgrade the computers. And we're going to make contributions to equipment purchases. So we put away a little bit each year so that when we're making major purchases, there's not a significant impact. Things like stretchers, cardiac monitors are the types of equipment that we'll be purchasing in the future. And by putting a little bit in, we will avoid that huge impact on the year of purchase. On the facility side, our buildings are in excellent shape. We have 3 stations. We have one located in Orangeville, we have one located in Shelburne, and one in Grand Valley. They are taken care of very well by our facilities people and at Dufferin County. However, we have allocated money this year and for the years to come to identify and to be used for large changes that have to be, or repairs that need to be made to our buildings. This concludes my report. I'd be happy to answer any questions that you may have, or if you require more information, please don't hesitate to give me a call. Again, it was Tom Reid. I'm the Paramedic Chief of Dufferin County Paramedic Service. My phone number is 519-941-9608, extension 1, or you can reach me by email at treid@dufferincounty.ca. Thank you very much.